You. Told you I'm new to this. Okay. All right, excellent. All right, glad that worked out. Okay, so I'm gonna go ahead and start over. So I'm Terry McGuire, the founder and CEO of Evolve Health and Wellness Community. No, it was not your phone, Dion. I clearly had it sideways. I'm a practicing physician assistant, and I am now entering my 9th year of clinical practice. I went to Duke University for PA school, and prior to that, I studied public health at the University of North Carolina at Greensboro, and I completed my undergraduate studies at Wake Forest University. So I am a North Carolina girl through and through. I've now been in the DMV area for going on my 7th year. And so, I came to Evolve. I really think that Evolve has been years in the making, but it really rested on me about a year ago, and I really started to brainstorm this thing because what I've seen in healthcare and just personal experiences, and we all know that our healthcare system is not in a great place at all. It's quite troubled. And so I just want to make a difference as it relates to health equity. And one of the ways that I wanted to do that was to address health literacy, because specifically when I'm in my own healthcare appointments, I recognize that if I did not have the medical background that I have, I didn't know the lingo or the medical terminology, my appointments would not be as seamless. And I recognize that people don't have that same privilege. If you don't understand what options are available to you. And, for a personal story, when I was navigating infertility, my reproductive endocrinologist was like, we were just doing the same cycle over and over again. And for a few, after a few tries, I'm like, this isn't working. And I know about other medications. I know about other procedures that can be done to at least investigate the underlying cause. And everyone does not have this privilege. And so I want to make sure that people feel empowered to have these conversations with their medical professionals so that they can know what options are available to them. If they don't want to pursue the traditional medical route and they want to take an alternative route, I want to make you aware and help you to feel empowered so that you can ask these questions and we can sit down together, develop a plan to move forward. I have countless stories, y'all, like practicing. One of the situations that broke my heart, I had a patient, she came in and I was seeing her for a completely unrelated issue, but for most of my patients, what I do is I look through their chart and just to make sure that they're up to date with things. And I noticed that this patient had a pap smear, but she did not follow up, and the pap smear had showed HPV, and so she should have followed up a little bit earlier than she even knew about, because I talked to her and I'm like, hey, I recognize you didn't follow up for this pap, and she had no idea about the results that had come in, and she had no idea about HPV or human papillomavirus. So it's really just like this patient sat down for a pap smear but did not understand the implications, what the results may mean. And HPV is one of the leading causes of cervical cancer. And so it was just kind of, it was a tough conversation to have because I really felt for her, but I'm just like, okay, where are we missing it? Where are these communication breakdowns happening? I have family and friends who reach out to me all of the time. Hey, Terry, there's this medication that my provider is recommending, but I'm not ready to go on medication. Is there a different alternative? Or I got these labs, I don't really know what they mean. Can you help me out? Absolutely. And so one of the things, again, I was brainstorming this all about a year ago, but then what really kind of sealed the deal for me is, we had a family member about a year ago that was fighting COVID. And, this was at a very, very scary time because this was before the vaccines were out. She is a middle-aged woman. She has other health conditions, and she had not been offered monoclonal antibodies. And so we know that monoclonal antibodies is a life-saving therapy. Well, it's a whole nother story right now with this variant, but early on there was this life-saving therapy that was available to patients, and we literally had to jump through hoops and go over hurdles to make sure that she was offered this therapy. That's life-saving, that, really. And we know that COVID-19 has disproportionately affected marginalized populations, Black, brown people, it is affecting us in disproportionate rates. And when we were calling her medical providers just to make sure that she's getting this treatment, it was almost like, how do you know about this if this is, if this is a secret? Like, she should not be privy to this information. Like, it was completely bizarre. And she had been to the ER multiple times, and it was the last time that she was in the ER. Like, because we couldn't be there in person with COVID and the precautions that are in place, we literally had to call the doctor on speakerphone to say, listen, like, we've exhausted all of these, options. She's been in and out of this ER. She is at risk for, really bad outcome. So, but it was very close to the end of her, like, that time plan. Like, you have 10 days from when you are diagnosed and when you start exhibiting symptoms to get this therapy. And so we were very close to that cutoff. And it was just a very frustrating experience. I could talk to y'all for days about all the experiences I have and why health literacy is so important. I'm thinking about another story that a family member is having some issues with her stool, constipation. And so, sorry if this is too much for y'all, but the doctor was prescribing her this medication to help with the constipation, but not recognizing that she, in her other medication list, she's on a medication that's also going to contribute to the constipation. So these are the type of things that I'm talking about. And so this is why, part of the reason why Evolve is being developed, so that I can offer that service to individuals, so that you can be more empowered, so you can be more aware of options that are available to you to increase and improve your health and wellness. And it's not just from an individual standpoint, like, we're also going to address it from an organizational standpoint, because we know a lot of our issues in healthcare are systemic. And, specifically around the time of George Floyd's murder, I saw so many healthcare organizations, like, it was just this rush and this momentum of, like, everyone was releasing these statements, and I was just really like, it was just a mind-boggling experience for me, because I'm like, this isn't the first time that this has happened. Like, this has been happening, and we have, been exposed via media of all of these cases of police brutality. So I'm just like, why now? Why are all these organizations coming out and releasing these statements about racial equity and justice? Okay, we're here now. They're releasing these statements. They're having these focus groups. So what are we going to do about it? And I honestly have not seen a lot of follow-up. I haven't seen a lot of initiatives. And it's like, once the dust settles, like, where are you going to stand? Like, these statements are great. They sound great. But we have to follow those statements with action. And so Evolve will have services for organizations as well to come in if you already have initiatives in place, so that we can examine those initiatives, help to refine them, shift some policies and change around, provide recommendations. Also offering trainings to your healthcare providers as well as any other ancillary staff. And I specifically want to use experiential learning and standardized patients. I think that is a great way to learn, so that you can kind of see firsthand how these communication breakdowns happen. And it's really not just communication. There's so much nonverbal, so it's not just when someone opens their mouth to say something, it's so much nonverbal communication. And that's one of the things. So our website is finally to the point where I would like it to be. It's not quite there, but it is available, and I want to put it in the comments so that you all can be able to go to the website, subscribe, and you'll also be able to receive an infographic. And it's an infographic for both patients and providers, and it just kind of goes over tips for both of those groups, so that you can take some steps in improving health literacy. And I say that, talking about the nonverbal cues, because once you walk in that room, before you even open your mouth as a provider, communication has happened. How are you presenting? How does your facial expression look? Have you checked your ego? Have you checked your biases at the door? So all of these things are very, very important. And these are the coaching and consultations that Evolve will offer. We are officially launching February 22nd, 2022. So those service offerings will be available at that time. Also available for speaking engagements, again, after our official launch. And so that's pretty much it in a nutshell. I could talk to you all for a long time about, our issues with healthcare, how we spend so much more money than other developed countries and our outcomes do not align, and specifically how our the disproportionate impact on marginalized population as it relates to from cardiovascular disease, infant mortality, maternal health. I mean, there are just so many issues. We focus more on treatment than prevention, and we certainly have to do better. There's so many organizations that are doing this work and trying to address health equity, but Evolve is doing it from a health literacy standpoint, and we are doing it uniquely, and we certainly believe in the way that we're going to address and the approach that we're going to take. And one of the last things I want to kind of talk to you all about is the Meditation Mondays, is the offering that we've been providing. It's really, historical racism is very, very important to me because it impacts health. No, we don't have a diagnosis code for it. No, it's no way to quantify it, but we know it's there and we know it affects our bodies. And when you're constantly and chronically exposed to the stress of racism day in and day out, it starts to take a toll. And so that's that concept of weathering. And then the allostatic load is, if you're no longer able to cope with that stress, like your body starts to break down, whether it shows up with high blood pressure, it shows up with your sleep problems, panic attacks, your immune system starts to attack your body. All of those things are a result of this added stress and this pressure. So I've offered these Meditation Mondays that are just give you an opportunity to stop, to be still, to listen, to check in with yourself, to check in with your body, and to kind of try to offset some of that stress, to increase your ability to cope, because it's the world that we live in. It's not right. It's quite unfortunate. But how do we try to help ourselves through it? And it's also helpful to be able to engage providers when you're able to sit and to be still, because you can check in with your body and you can say, hey, yeah, I have had this headache. But as you're centering and you can kind of think about what's coming up for you, what has been on my mind today? What has been stressing me out recently? And so when you go into your provider, you can have a better conversation to say, like, yes, my head has been hurting. I realized it was hurting around the time I had XYZ going on. And so that's really important, because sometimes patients will come and say, well, this is bothering me. And when I ask for more information, they can't really describe it. They can't put it into words. And so this health literacy is certainly something that we have to address from the patient level as well as the provider level. But it's not just, low income. It's not just certain people who've attained a certain educational status. I talked to someone recently, and she's doctoral level, but she basically was like, hey, I have been neglecting my health. And that was her own words. I've been neglecting my health, but I want to do better in 2022 moving forward. I have these health conditions, but I don't really know which steps to take. Give me some tea. I don't really know what steps to take. And I'm like, you know what? You would be a perfect client for me to work with. We can sit down, we can develop this plan and help you out. So that is my baby, Evolve Health and Wellness Community. Our website is evolvehealthandwellnesscommunity.com. It's long, but once you get it, you can bookmark it. Some things that we have coming up. My coach is joining the live, my business coach, and she has her podcast, The Healthcare Connector, and I will be a guest on her podcast next month. Not sure the release date, but I will actually I'll record on February the 5th, and then our official launch is February the 22nd, 2022. So 222. We are on LinkedIn, we're on not Facebook, we're on LinkedIn, YouTube, and Instagram. So that is Evolve. If you all have any questions, feel free to DM, send a message. I look forward to working with you all. And until next time, in love and evolution always. Bye.